Way too often, we hear news stories about the atrocities that black mothers have to face due to the American healthcare system that consistently continues to fail them. Shalon Irving's is unfortunately just another speck on the wide spectrum of black individuals that have had to face the brunt of this disparity. Shalon Irving was a 36-year-old lieutenant commander in the U.S. Public Health Service Commission Corps and a CDC epidemiologist. As a black woman, Shalon's own death now shows a grave example of the very health disparity she was working to eliminate. Reaching up one arm, Shalon Irving made a gurgling sound and collapsed in her home in Atlanta just 3 weeks after giving birth to her daughter Soleil. Paramedics found this 36-year-old new mother without a pulse and not breathing. An autopsy report later revealed that she died of hypertension complications. After giving birth to her baby, Shalon had a sudden spike in her blood pressure, and despite seeking medical care, she was told by her provider that her symptoms were very normal. The CDC finds that most maternal deaths happen postpartum, and the lack of attention this new mother received is blasphemous. After her fourth visit to the hospital in the 3 weeks after she gave birth, Shalon Irving collapsed due to what her mother, rightfully so, refers to as missed opportunities to save Shalon's life by her healthcare providers.
While Shalon's experience is heart-wrenching and definitely avoidable, this is a major reality for black mothers across the United States. Irving was highly educated, well-paid, and had access to the best healthcare. But even all of this was not enough to save her from the overpowering indignities of racism. Black mothers are 3 to 4 times more likely to die and 2 times more likely to suffer from life-threatening complications. With such unacceptable racial inequalities, we must understand how racism towards black women originated. Dr. Cooper Owens is a professor in the history of medicine. In her commentary for the American Journal of Public Health, she discusses how the institutional racism that kills black mothers today can be rooted to the United States history of slavery. She provides evidence for how doctors only acknowledge the health status of enslaved women so that they are ready to be sold. In 1858, Medical Journal even stated that being able to determine the market value of black bodies was a key skill doctors needed to have. In fact, there were laws passed in the 1660s that allowed for slave owners to force black women to bear children so that enslavers could build capital. By viewing black bodies as profits, it shows how medicine during that time only valued the interests of slave owners. To top it off, James Marion Sims, known as the father of American gynecology, pioneered the surgeries we know how to do today by performing on enslaved women's bodies. It is no wonder why there is such an inherently and deeply rooted mistrust black people today have in the U.S. healthcare. How can they trust their OB-GYNs whose forefathers experimented on enslaved women, valued only their ability to produce children and means to continue slavery? Dr. Cooper Owens' research also highlights that these historical stressors add to the stress that black women already face in our contemporary world from repeated exposure of discrimination can lead to physical effects on the body. This phenomenon is called weathering. Geronimus was the first researcher to theorize the effects of weathering on black mothers back in 1992. Geronimus then led a study in 2006 focused on black participants and measured the biological markers of stress such as high blood pressure and cholesterol, assigning a score for each participant in the study via an algorithm. Black women had much higher scores than white women. The results are consistent with the theory of weathering since it confirms that racial discriminations black women face leads to biological stressors that physically affect their bodies and contribute to the higher risks black mothers face during pregnancy.
Unfortunately, the society we live in has conditioned the victims of injustices to internalize racist stereotypes. They thus support their own subordination and suffering. When people studied focus groups, they found that black women feel disrespected during their care and can feel very clear implicit biases in the treatment of black patients by healthcare providers. One mother from this focus group spoke about her experience with implicit bias during her birthing experience. She was in extreme pain, and despite expressing her pain to the nurses, she wasn't looked after. She was clearly upset at this kind of treatment, but did her very best to suppress her otherwise very expressive face, so as to not feed into the stereotype of black women being very angry. Reproductive justice is a framework that can help us understand better how women of color can take back the dehumanizing nature of reproductive politics and create a cultural shift with its ideology. According to Loretta Ross, reproductive justice activism is based on the basic human right to make personal decisions about one's life and the obligation of the government and society to ensure that the conditions are suitable for implementing one's decisions. This framework opposes the ideology of white supremacy that encourages unequal law, practices, and social outcomes based simply on race. It is clear that racism is a driving factor in Black maternal deaths. So, what are some potential solutions to this problem? Several NGOs realize this grave issue and work with the aim to use radical reproductive strategies to fight against what Loretta Ross refers to as reprocide, the idea that reproductive oppression is genocide. One such NGO with the reproductive justice framework at its core is Sister Song. Based in Atlanta and founded by women of color, this NGO aims to build a network of individuals and organizations to improve institutional policies and systems that impact the reproductive lives in marginalized communities. With programs ranging from reproductive justice training and leadership development to focusing on Black women's issues as well as mapping birth work for Black women, Sister Song uses an integrative approach to counter largely intersecting issues of racism.
NGOs like Sister Song definitely provide strong support for Black mothers, but this rooted problem of implicit bias within healthcare professionals still remains. Vice President-elect Kamala Harris has proposed a bill while she was a California senator in 2019 called the Maternal Care Access in Reducing Emergencies, or the CARE Act. The bill proposes grants for healthcare training programs to implement implicit bias training and will require the National Academy of Medicine to study implicit bias and make recommendations for how to assess it within clinical testing in medical schools and other healthcare training programs. These policies are needed to help combat medically institutionalized racism. With the future Biden-Harris administration on the way, we must stay adamant in making sure America does not keep failing Black mothers and continue the fight against racism.